Hello, my name is Bree Morris and I'm the Associate Director of Strategic Initiatives here at the National Community Pharmacist Association. I'm so excited that you've signed up for the NCPA APA Adherence Project sponsored by Pfizer. Today we're going to go through some background on medication synchronization, or the appointment-based model, and what it can do for your patients and for your pharmacy. This presentation is called Healthier Patients, Improved Star Ratings. So full disclosure here, I do work for NCPA, and my slides have been peer-reviewed. What we're going to talk about today is how to set up a MedSync program for your patients and to improve star ratings, and also how it can positively affect your pharmacy operations. And then we're going to discuss 3 workflow or staffing considerations you want to think about anytime you implement a program like this. So questions we'll answer. Why should I, as the community pharmacist, care about adherence? What sort of things are in my adherence toolbox? What is MedSync? How can it help my patients and my pharmacy? And what resources are available to me as an NCPA member? Adherence is a $300 billion problem. We spend that much in direct and indirect cost. About 70% of hospital readmissions are due to medication-related issues, and about 3/4 of all of total healthcare spending is spent on chronic disease. So we can have a significant impact in this market as community pharmacists. Many stakeholders are starting to see the value in drug adherence and are motivated to improve adherence. For community pharmacies, it's important to understand the factors that drive the increased emphasis on adherence, the benefits to the pharmacy, meaning, most likely more prescriptions filled, improved patient outcomes, and the role of the community pharmacy in improving drug adherence. In 2008, the Center for Medicare and Medicaid Services developed a plan rating system that uses stars to rate Medicare health and prescription drug plans based on quality. The rating is similar to what's used in the nursing home setting to measure quality. Plan ratings are rated on a 5-star system, 1 being the poorest rating and 5 meaning the best. And these ratings are featured on the Medicare Plan Finder tool on Medicare.gov that beneficiaries and their caregivers use to compare Medicare plans. The plan's overall rating of a 1 to a 5 gives consumers, that single summary score that makes it easy for them to compare plans based on quality. Adherence measures are weighed heavily in this system because they're considered intermediate outcomes. And because of that weighing, the 3 adherence measures account for nearly 30% of the overall star rating for prescription drug plans in 2013. So here's a look at where we are right now with star ratings. The average 2013 rating was a 3.3 for Medicare plans, and there were 39 Medicare contracts that have been indicated as a low performer. And what this means is that they've gotten a 2.5 stars or less over the past 3 years. Now, the Medicare star rating system is to rate health plans, and I know there's been lots of talk in the industry recently about pharmacies' place in these Medicare plans and what that means to you and your pharmacy. Excuse me. So here we go. How will prescription drug plans and Medicare Advantage prescription drug plans raise those star ratings? Well, they're going to start looking to pharmacy for solutions. They're going to choose pharmacies that help them improve some of those star ratings to be part of their network or preferred providers or preferred pharmacies, and they're going to offer incentives for those pharmacies. It's very probable and likely that some of these plans or some of these pharmacies, that don't help achieve that rating might also be out of the plan. So here are the 5 focus areas of the Medicare star ratings that pharmacies can really have a significant impact with. There is a measure that deals with high-risk medications in the elderly. This is basically the use of Beers List drugs in your elderly patients. There's also a measure that deals with diabetic patients who are on an ACE or an ARB, so ensuring that all your diabetic patients are on an ACE or an ARB for renoprotective benefits. And then there are 3 adherence measures, as I mentioned earlier. There's one that deals with oral diabetic medications. There's also another with hypertension agents. This is looking at the renin-angiotensin system antagonist, so basically your ACE and your ARBs. And then adherence to cholesterol medications or statins. So medication really is confirmed as a cost saver in several different diseases. I've got the ROI up there for a few different chronic diseases that you probably see in your pharmacy quite often. The biggest ROI is hypertension, followed by CHF, diabetes, and then dyslipidemia. So you can really see that the impact that pharmacies can make has a significant impact on the total healthcare cost and bringing all of that down. So the Congressional Budget Office estimates that if we can spend 1% more at the pharmacy counter by our Medicare beneficiaries, then we'll save the total Medicare spending system about 0.2%, which doesn't sound like much, but that's actually $1.7 billion. So we can really have a significant impact there. So why community pharmacist? This past June, in June 2013, NCPA put together a survey along with a group by the name of Langer Research, and we went out and surveyed 1,000 adult patients who were on chronic medications, and we asked them several things about their adherence and tried to identify some of those barriers and reasons for patients that were not, reasons why patients would be non-adherent. And what we found was the patient's connectedness or relationship with their pharmacy was the leading predictor of adherence. So that's great news to you as an independent pharmacist, and community pharmacy being your business. That's one thing that we excel at, is getting to know our patients and building that patient-pharmacist relationship. So you really are those trusted medication experts. You're the most accessible provider in the community, and you're a key touch point in the care continuum, especially if you're in a rural area and your patients really do look to you for advice. So a great way to get involved is to do first fill counseling. You can also utilize some pharmacy reminder systems, such as calling programs. And first fill counseling really is the key to adherence improvement. And there's also ways to improve outcomes through the hospital discharge process. Your diabetic patients are a great example. Your diabetic patients cost you, between $4,500 and $12,000 annually. And as you help your patients improve their health and get your diabetic patients on an ACE or an ARB and get them to be adherent to their oral diabetic meds, thus increasing the quality rating for the health plan, there's also some additional revenue producing opportunities there to be found. So what's in your adherence toolbox, and what can you use? Well, here's a look at what the independent industry has been doing. Adherence counseling, about half of all independents are doing some sort of adherence counseling. Another 40% are doing compliance packaging, synchronized refills, or even refill reminders. And then we also have 13% that are doing some motivational interviewing. So there's lots of things you can do in your pharmacy that aren't necessarily time consuming, but a great way to get involved and offer your patients some adherence services. So what is medication synchronization? Well, medication synchronization, or MedSync for short, is really coordinating all the patient's medications to be filled on the same day. It was actually invented by an independent pharmacy owner in California in the 1990s by the name of John Sikora. And John had lots of elderly patients that were on several chronic medications, and they really had a problem with adherence. They would lose their pills or lose their pill boxes or not remember how to take their medication. And he also had some staffing constraints, and he was trying to solve that. He had a challenge to provide care to these patients under some staffing constraints. So what he came up with is called the appointment-based model or medication adherence, and this is his theory to improving patient care and also improving pharmacy operations. So that's really what MedSync is coordinating all the patient's medications to be filled on the same day, and it is actually brought to us by another independent pharmacist. And right now we have about 1,400 community independent pharmacies around the country that are doing a MedSync program. So I always like to start off this presentation by talking about what MedSync is not. MedSync is not the same thing as auto refill. What really differentiates this from auto refill is that MedSync is focused on the patient, and they're actively involved in this process. Every month, the patient receives a call from the pharmacy, and they're asked several questions. Have you been to the doctor recently? Have you been hospitalized? Is there anything that we should know about your medication? Have you had any side effects? And do you need anything over the counter, or is there anything we can add to your refill? So you actually give the patient the option to be a part of their healthcare team, and they get to talk to you about the medications, and you're able to address those issues right there on the phone. And then the patient also has the option to pick up their medications at their local community pharmacy, unlike some of the auto or mail programs. So synchronization is a win on all accounts, from the patient to the pharmacy, even to the health plan. By calling the patient every month, you're able to identify any potential barriers to adherence. I stopped taking my lisinopril because I'm allergic. Okay, well, what's your reaction? Well, I had a cough. Well, then you're able to address that and get them prescribed on something else. Or, no, I haven't taken my metformin because my blood sugar has been good. Only take it when my blood sugar is high. Well, as a pharmacist, you're able to address that clinical issue that you might not have known about had you just waited for the patient to come in and get their prescription. Also, you can keep better tabs on your patient because you review their entire prescription record every month, and you can notice, okay, well, I haven't seen Miss Smith in for it looks like about 45 days, and she should have been due in 2 weeks ago to get this medication, and I haven't seen her. Gives you an idea of those patients you should watch out for, and give them a call and make sure they're not having any issues with their medicine. Also, from a pharmacy perspective, it's really great. You're going to fill more prescriptions, and it changes the dispensing function from a reactive to more of a proactive system. And we'll talk about this in a minute, but NCPA just released our first study with a TEM, Time My Meds, which is a MedSync platform out in the market. We took about 10 independent pharmacies nationwide and looked at patient adherence for a 6-month period. Patients had an additional 103 days on therapy due to a MedSync program than those that were not in a program. Also, pharmacies filled an additional 3.4 refills per prescription per patient. Well, the average patient was on 6 prescriptions a year, so the pharmacy filled about 20 extra prescriptions per patient per year. Those are some pretty solid numbers that you can bring home to the bank, and it really gives you a motivating factor to participate in this program. So here's a little idea of what you can expect when you do medication synchronization or implement the appointment-based model with your pharmacy. It's going to be more of a streamlined workflow and a predictable workload. You'll know when your patients are coming in to pick up their medication, and you'll know your Mondays will be a little bit less hectic. You won't have so many last-minute refill requests on Friday afternoons or before holidays. Also, there's going to be better inventory control, and there's more time for some other pharmacy services. You'll spend less time in the delivery car, or your staff rather will spend less time doing that. I spoke to a local pharmacy in Arkansas the other day that has synchronized all of his patients based on his delivery prescriptions. So he divided his town into 4 quadrants and delivered, the first week of the month he would deliver to quadrant 1. The second week, he would deliver to quadrant 2, 3, and 4, and so on. And so it's a great way to decrease some of those expenses that you're probably going to have in your community practice, and also improve the patient care whenever you do that. You also will have less reversing for no-shows because your patients will feel inclined to pick up their medication and be adherent. They're also going to appreciate that you offer this service. When I was in pharmacy school, I worked for a grocery store chain for a little while, and one of the biggest suggestions we got in that practice was, I have 4 prescriptions and I get 4 text messages to say they're ready. Is there any way that you can please get them ready on the same day? And we didn't offer a solution for those patients. We had no way to offer a solution. We just said, I'm sorry, ma'am, we can only get you your prescriptions when they're due. But through this program, through medication synchronization or the appointment-based model, we're able to get those patients synced up so that they can come into your pharmacy one day a month and get all the prescriptions, and it's better for them and more convenient. So you're going to work smarter, you're not actually going to work harder. By synchronizing your patients' refills, your workload is really simplified as well. Pharmacy operations become more streamlined, daily workloads are predictable, labor costs go down, along with the stress levels in your store. And with just-in-time ordering possible, inventory control is also improved. And the end result is that you're really going to have higher gross margins, lower expenses, better cash flow, and a healthier bottom line, which is pretty great. The results we've seen so far have been pretty amazing. We have one pharmacy that was able to reduce store hours by 10%, cut payroll expenses by 50%, and triple inventory velocity from 12 to 36 turns per year, which I think is pretty impressive. And another pharmacy saw a 30% increase in gross margin. Saw a 30% increase in prescription volume and a $1.87 increase per prescription increase in gross margin. Sorry, I got a little tongue-tied there. So I like to describe implementing a program like this in 3 different steps. First, you have the setup or the startup procedures, who's going to be in charge of the program, how are you going to implement it, how are you going to market the program. Then you have the initial refill synchronization process, and then the ongoing program operations that you want to think about. So the first thing to do when you start a MedSync program, and first of all, I should let you guys know, these are the instructions that you want to think about when you set up any MedSync or appointment-based model program. The directions I'm going to go through right now are mainly for a manual program. And I'll try to point out at different points the times when Prescribe Wellness is actually going to help you with some of those workflow tools and how that system is going to sort of be integrated into this process. So when you set up a MedSync program, the first thing you want to do is make sure your entire pharmacy staff is aware of the program, but you really need to dedicate a staff member to serve as the program manager for this program and to coordinate the day-to-day operations. Now, in a manual program, the patient will be pulling patient files, calling the patient and reviewing medications and making notes for the pharmacist. In your prescribable system, a lot of that will be done on the computer. The files will be on the computer. You have the option to either do a live or an automated call to the patient to review medications, but then they'll still be making notes to the pharmacist. We usually suggest that the program manager be a lead technician. It really doesn't have to be a pharmacist. Organizational skills are important, and having a solid understanding of the medications, including pronunciation and indications, will ease the communication between prescribers and patients. So in terms of a time commitment, when you first get started, your program manager needs to be able to devote about an hour to a day to this program. So some free tools and resources that are out there. There's the appointment-based model resources that are on NASPA's website, and NASPA is the National Alliance of State Pharmacy Associations, that are free and available to anyone. Also, as a member of NCPA, you are able to participate in our Simplify My Meds program, and with that you get an operations manual, patient forms, physician letter and faxes, as well as the occasional newsletter. The operation manual will be available in the pharmacy binder that you either received live at our training or that will be available online. There's also a marketing kit that you receive as being part of this program. There's bag stuffers, brochures, and a poster in that kit. Every Arkansas pharmacy that's participating in this study will receive a marketing kit. This is what you picked up at the live training, what will be mailed to your pharmacy. This program is free to NCPA members, so if you have any friends that are not participating in the study, they can also be a part of this program if they're an NCPA member, and information on that is at ncpanet.org/SMM. And I thought I had a picture of the materials for you guys, but you'll actually get that in the mail, so you can look at it then. When you go to identify patients, synchronization can really help most of your patients, including those who are on complex regimens, even those who might be on one or two medications who really forget to request their refills. It can help your elderly patients who have difficulty driving, or even busy professionals and caregivers who can't always get to the pharmacy. Coordinating your delivery patients, as I mentioned before, is also an economic way to reduce your expenses. And lastly, new medication starts are really a great opportunity to talk to your patients about the importance of adherence in your program's coordinated refill program. Studies show that the highest medication drop-off really occurs within the first 3 months of chronic medication therapy. So that's a really great population that you want to look at. This is an opt-in program. I forgot to mention that earlier. So one thing you want to do from every patient that you enroll in this program is get them to sign a patient agreement. And so if you have our Simplify My Meds operation manual, which is part of the binder, and it's also available on our website under ncpanet.org/adherence. You can receive that pharmacy operation manual for Simplify My Meds. Anyway, on page 16 of that book, you'll find a patient agreement, and it's important that you get every one of your patients to sign that agreement. It just says that they agree to be part of this program, that you're going to synchronize their medication, and that they agree to a call every month from the pharmacy. It's just a one-time process, but it's really crucial to the participation in the program. And you just want to keep those in a file somewhere, just in case you get audited or something later on, you have those forms. So synchronization, how does this really work? Well, this is the slide where everything happens. So the first thing you want to do is determine the list of chronic medications that your patient will be taking. So our example right here, the patient is on lisinopril, Crestor, and metformin, and you want to pick the anchor that all of the other medications will be synced from. So in this case, this is going to be the highest copay medication, and that's going to be the Crestor that is due on the 16th of every month. So we'll make sure that the lisinopril and the metformin come due on that date as well. Then you calculate the quantity needed for each medication to synchronize it with the anchor med. So there's a lot for the lisinopril, that's going to be 12 tablets, and for the metformin, that'll be 50 tablets to get them to come due on the 16th. Next, you contact the patient's prescriber by phone or using the physician fax form and request 2 prescriptions for each synchronized medication. One for the quantity required for synchronization and a second for the normal monthly quality. Now, steps 3 and steps 4, actually, all of these steps will be done for you by the Prescribe Wellness system. It will walk you through every step. You don't have to manually calculate the short fills, and a fax will auto-generate for those refills that you're actually going to need. Then you short fill the appropriate quantity of those other prescriptions to synchronize with the anchor medication. So in this case, it's going to be, you're going to short fill the lisinopril and metformin to sync it with that Crestor. You always want to document on the hard copy of the prescription that this one-time short fill was for an adherence program at the patient's request, so that you have that in case you would need it later. So paying for short fills. This is probably the most challenging part about the synchronization process. Some plans will authorize short fills if you call and request an override. Other payers may not, so the out-of-pocket cost may fall on the patient. I know that sounds kind of daunting right now, but actually what we found, like I said, we have about 1,400 pharmacies that are doing this nationwide. What we found is that most patients are okay with paying a little bit out of pocket, just out of pure convenience that they can pick up all of their medications at once. And remember, in an anchor, you're going to choose the anchor medication as the highest copay medication, so hopefully they won't have to pay too much out of pocket. Some other examples are, if it's permissible in your state, you could possibly waive the copay for that patient or get some physician samples. There's also some changes in Pharm.D, and I'll go through that here in just a minute. If really is an issue for your patient and you're unable to do that, one way that you can get your patient synced is to refill their prescriptions early for 2 to 3 months to synchronize their medications with the anchor med. There are some changes to Medicare Part D this year in 2014, which make it pretty nice. They offer a prorated copay for these short fills, and this applies to basically any short fill of an oral chronic medication for the patient. It excludes antibiotics. So I actually thought that I put those submission codes in here, but I guess I did not. So there's 2 different codes that you should be aware of. And these codes were designed specifically for an adherence program to prevent rejection. There's code 47. Code 47 is what you'll use in your Medicare Part D patients on that initial sync when you're trying to get paid for those short fills to sync them up. And then if you try to fill again on the subsequent fill and you get a refill too soon rejection, then you can use code 48, and those are submission clarification codes for the purpose of sync. So that's a great way to get your Med Part D patients synced, and I hope that works for you guys. Dispensing fees are also likely to be addressed in your pharmacy contracts. So most of the interactions in the pharmacy relate around the patient pickup date. So a week before they're due to come in, so in our example, I believe the patient was synced to the 16th of every month. So on the 9th of every month, the pharmacy would pull patient files and call the patient to review the medications, ask about any recent hospitalizations or doctor's visits, any changes to their medicine, any side effects, anything that the pharmacy should really be aware of. This will actually be done as part of the Prescribe Wellness system for you guys. You can either do a live call, and there's a script there available for the patient, or you could do an automated call. They have the capability to do as well. So then 3 to 7 days before they're due to come in, then you review any prescriptions that have 0 refills, update the patient profile in the dispensing system, and this is usually done by the program manager. And then a day or two before the patient is due to come in, then you get the pharmacist involved. The pharmacist reviews all the orders, identifies any clinical issues that the program manager saw, possibly calls if there are any issues to talk with the patient. And this is when you review your inventory and order any of those expensive products that you might not have in stock. And then you dispense the product and call and remind the patient to pick up the prescription. There's actually an automated reminder call as part of the Prescribe Wellness system that will help you out here. So tips from the expert. Tips from the experts, the actual pharmacists that are actually out there doing this program. Like I said, it is helpful to designate a technician to run these day-to-day operations, a program manager. I've talked to a couple of pharmacies that have called this person their Simplify My Meds specialist, and patients know to ask for this individual. Also, it's helpful if you look at your pharmacy management system. Some of the systems will help you identify non-adherent patients, will group patients by their sync date, and there are some reports to help with patients. Also, the Prescribe Wellness system has a couple of really great features that help you sort patients by the date they're due to come in whenever you're identifying patients, and that's a great way to find new patients that might be great for MedSync. Also, when you start out the program, you want to test it out on 5 to 10 of your most loyal patients first. Anytime you start a new program, there's going to be hiccups along the way. So you definitely want to start out with those loyal patients who will agree to be guinea pigs for a little bit. You also want to engage your frontline staff. They really are your best marketers. A lot of times when we talk about this program, a great way to market to your employees is to say, hey, Miss Smith that comes in a couple of times a week, and she brings in 5 medications at once and wants us to fill them in 5 minutes and before she gets out of the door. Wouldn't it be nice if we could just be prepared for that, and we could have all of her prescriptions ready to go when she stepped in the door? That's a great way to market it to your pharmacy staff, because then they understand that it's also going to help them out in their workflow, and so they're not so busy on those busy times. And here's a little bit about the study that I mentioned earlier that we just completed. Our patients had an additional 103 days on therapy, and pharmacies filled about 20 extra prescriptions per year in this patient population. Those are pretty big numbers, and it's pretty exciting that we can have such a significant impact. And MedSync, or the appointment-based model, is really just the foundation of several things that you can do in your practice. I mentioned earlier, it moves the dispensing process from a reactive to a proactive model, so that you have some more time to do some of these other things that help your patients out. So compliance packaging, medication calendars, immunizations, disease state management, the list is endless of the things that you can do, and this just gives you a little bit more time to do those things that you learned in pharmacy. So what are your peers saying? I've been a pharmacist for 50 years, and this is one of the best ideas I've seen in a long time. My staff received a transfer with 25 prescriptions the other day because they were looking for a program like this. And doctors are loving the program, and they see it as an extension of their own service. And that's something that we've seen a lot at NCPA as well. It's amazing to me to see how the Simplify My Meds name has gotten out there. I was talking to a pharmacist from Milwaukee recently, and a health plan in his area had Googled Simplify My Meds Milwaukee, found his pharmacy, and now he's part of an Adherence performance network in their area because she found Simplify My Meds in Milwaukee, and it was his pharmacy. We also have been able to set some pharmacies that are doing Simplify My Meds up with some physician groups in Maryland to be part of 3 ACOs, just because they heard about Simplify My Meds and the great service that it offered to the patients. So there's really some great opportunity there. We're very excited about this project and what you guys are going to be able to do with Adherence in the state of Arkansas. And thank you so much for partnering with us on this great project. Here is my contact information. You can reach me at bree.morris@ncpanet.org. If you have any questions about anything, I'd be more than happy to take those, and thank you for listening. Have a great day.